Welcome back. Today is National Depression Awareness Day, and our sponsors at Brylin Hospital are committed to helping end the stigma around this condition. I'm joined now by Dr. Wendy Weinstein with more details. Hi, Dr. Wendy. Thanks for joining me.
Thanks for having me again.
Of course. We always talk about some important subjects when it comes to mental health when you're here. So I want you to first, Dr. Wendy, tell us about depression and how it affects people.
So depression isn't just about having a bad day. Depression is a whole constellation of symptoms. So if someone says that they are feeling depressed or they have loss of interest, you want to take that seriously. But along with that, usually someone will come to you and say, I'm having difficulty sleeping, I'm having difficulty with my appetite, I feel really slowed down. And then later on, they may start to say, I'm having bad thoughts or thoughts that I'm like not good enough, or I'm feeling really guilty about not participating in things that they're doing just fine in. So it's in their mind.
Yes.
You know.
And so those are some of the common symptoms, right? Let's talk a little bit more about things that we notice about people that are in our life, whether your family, you know, a romantic relationship, mentors. What are some of the signs that we can look out for?
So basically, if someone starts to become withdrawn and isolative, that's very important. Or you used to be the life of the party and a lot of fun, and now you just don't want to go out anymore. Maybe you used to sleep 8 hours a night, and now you're waking up at like 3 or 4 in the morning, and you just can't fall back to sleep because your thoughts are just thinking, you're just thinking, and you're just tossing and turning. Maybe you've lost weight, or you're not interested in food anymore. Maybe you are having difficulty focusing. A lot of people see me and they think that they may have attention deficit, but in fact it's just their depression because their concentration and their ability to focus is so off because of the depression.
Right. And, you know, those were kind of the obvious signs, but what are some of the uncommon signs or the things that aren't as obvious?
Not as obvious as someone who becomes very angry. So you can see people that all of a sudden become angry or like irritable or agitated, where they just don't feel like themselves and they may be short with you, where someone you used to say, can I ask you a question? What are your thoughts? And they're like, no, leave me alone.
Right.
You know, and you're like, this is off from their normal state of being.
Now, we're talking about these symptoms because intervention is important, right? And do you want to talk about why early intervention is so important?
It's so important because the risk of suicide is so high with untreated depression. 50,000 people in 2022 took their life to depression. So we talk about stigma, we talk about depression, we talk about treating it, but people are losing their lives because of this disease, where it's very treatable.
Let's talk about how we can eliminate the stigma around mental illness and why it's so important. Because, Dr. Wendy, this is a disease or an illness that does not discriminate.
It doesn't discriminate. You can be older, younger, culturally, it just does not discriminate. And the stigma, to get rid of it, is so important because the issue is that because we don't see it, people kind of don't believe it. And it's just like heart disease, it's just like high blood pressure. If someone had high blood pressure, they'd stay on their medications, they'd be very serious about taking this into consideration. So I think the issue is because we don't see it, and because it's many times people say, oh, I'm just weak. It's a sign of weakness, when in fact it's not. Saying that you have depression is a sign of strength, and that you want help and you want to get well. So it's hard to really get rid of the stigma if people don't see that it's a real disease, even though we can't see it. I always tell people, you know, your brain is connected to your body. It's an organ, just like every other organ in the body.
And you mentioned it, but this is something that is treatable. And do you want to talk about what treatment might look like?
So treatment is multifactorial. There's medication, and there's also therapy. Therapy talks about issues going on in one's life that could be playing into the depression, issues that could be making you feel worse. Then there's medications, which are extremely important and can turn someone's life around within 4 to 6 weeks.
What does Brylin do to help kids or adults that are struggling with depression?
So Brylin, we have a program there. I'm the adult unit chief there at the hospital. And basically it's an inpatient facility where if you call, if you're in crisis, and even if you're not sure, better to err on the side of caution. You can call and you'll be interviewed by a nurse, and then we'll assess whether or not it's important for you to come into the hospital.
Okay. How can people connect with you and learn more about all that Brylin has to offer?
Well, Brylin's number is 886-8300, and they can call that way, or they can go on Brylin.com. They can Google and find it that way as well.
Alrighty, Dr. Wendy, thank you so much for coming in and sharing more about this important topic of discussion. Viewers, you can learn more about all of the services that our sponsors at Brylin Hospital have to offer by visiting Brylin.com. Thanks again for coming in.
Thank you so much.